and warm welcome to our overseas guest from US. We have Dr. Kruger. He's from Cincinnati and he works with Deorari, our DM student who went to US and he's working on epilepsy. And Kathy, and we have Gibson, Tanjala Gibson, and the founder members from the TSI India Alliance, and Preeti and Madhumita from AIMS, and Madhurika Kabra. I think it's a real good initiative for rare disorders to advocate among the policymakers, also to disseminate among the clinicians, the pediatricians, the obstetricians, neurologists, maybe nephrologists also because it has, and hepatologists, multidisciplinary people, get them together on same board. Education is one part. Then family voice is so important for all this. Families have to come together, especially who are passing through this rare disorder, because they will be able to tell you what are the challenges which are there while they visit the healthcare facility and how they have to be fixed. We all keep on talking about we need to provide universal health care to all our society in times to come. And to do that, it is so important that we have to also take poor patients on board, people who are not educated. We need to make sure they also get the same care which the richer are getting. There should be no discrimination. And to me, the context of India is a little bit different. Experience of care for a patient visiting a hospital determines whether the patient will come back to the hospital or not, especially if the patient has got to consult various departments. So you need to think in long term, because these patients are going to be not in large number, that can we convene a board of experts who can come at some particular day and time and sit together and discuss in a holistic manner what the management of the child has to be done. The primary responsibility for this will get to, I would say, for children and pediatric neurologists, who will be the lead person. But the genetic support is also paramount. We also need to look at what the natural history of these patients would be in times to come, because you need to contribute to the science also, which will help globally all the patients who are in the network which the Alliance is trying to make. Maybe drugs which are the best drug, which can be efficiently used for controlling seizures, need to be studied. And if the numbers is less, maybe doing a multi-site study and getting and following those patients in long run is going to contribute to the science and lead to better patient care management in times to come. Again, to me, it looks, for doing all these things, there has to be at least few champions or passionate individuals who are ready to bind everyone together. It is not only passion and championing a cause. The most important thing is whether that person has also some leadership quality to get other people on board, because other people also are leaders and champions in their respective field. So think about that and try to see how we can raise resources and advocate this and convert even the leaders in the institutions who are the CEOs of the hospital. CEOs means the medical superintendent or the director of the hospital. They have to also, if they are not aligning to that, they will not give you the space, they will not push it. So how do you convert those leaders into it? The best way is you need family voices which have to get to them. And a group of community which has to be created who can, because while they talk, it is their conviction from heart, because it is their own feeling which is going to be passed on to those leaders. Otherwise, leaders are very, each leader is very hard, like a stone. It is very difficult to melt him because there are so many people who want to melt him because everyone wants his or her share. So think about that and involve more and more patients in the country. Get a system of making a registry of these patients. And I am so happy you are going to make an e-learning platform or a platform through which you will have all the resources which are going to be shared for the families. You can have a portal for clinicians and physicians. You can have a portal for the families, both. And disseminate that information through the professional organizations like the Indian Academy of Pediatrics, National Neonatal Forum of India, FOGSI, Federation of Obstetrics and Gynecology Society of India. So you will have to start thinking, how do you percolate there into those professional organizations, because they control the majority of the private sector. The public sector is only 30%, 70% is controlled by the private institutions, private players. So how do you reach more and more workers or a clinician or the nurses who are there in the community? And while you have this thing which will roll out more and more, you will have to get into how do you support families who will have neuromotor disability and other things. That also will have to chip in, and you will have to create a system for that. So you will need more people who will join and who will be looking into neuromotor disability and support, and maybe autistic disorders are going to be ADD may be common in this. So again, that has to come into play. So think little big in a larger picture. Put all the things in a framework. Take help of Madhurika, Nirja and Shefali Gulati, and then plan out how this has to move. You cannot have everything all together at this point of time, because I have seen over years, it is always very you have to struggle through converting people for years together, and then only the voices are heard by the people. And then you have to connect to the political leadership. You have to also connect to the bureaucrats who are sitting there. How the resources are going to get mobilized for supporting this initiative in various public health facilities. Or maybe you will have to make network. 5 institutions, regional network to begin with, where all these patients will report. And how do you get support for that? And how do you create that through a national health mission, which is Government of India, through which the government health programs get into, or get into RBSK program, this Rashtriya Bal Suraksha Karyakram. There is a program which is there, which is for deficiency, disease and disability, RBSK program. You know about that, which is running for the last 4 years. How do you get it plugged there? So think about that, and I think we are lucky, Department of Pediatrics. We have Vinod Paul sitting there. They have made a policy. He was part of the policy which is made for the rare disorder, which Government of India has already just released at this point of time. So think about that, make plans, and my best wishes, and from Department of Pediatrics, whatever support is required, we'll try to support you all. All the best. Good luck.